In this lesson, we'll look at two psychotic disorders, schizophrenia and dissociative identity disorder. Schizophrenia means split brain. A person with schizophrenia has a distorted reality. What is going on in their mind, the things that they are experiencing, are very different from everyone around them. There are two different onsets. First of all, the most common onset is an acute onset, usually begins between the ages of 18 to 25 and comes on very sudden. But there is some cases of a chronic or a slower progression of onset. There are two different categories of symptoms. You have positive and negative symptoms. First of all, positive symptoms are symptoms that people have or behaviors that people have in addition to the norm. So they have inappropriate behaviors. The first one, disorganized thoughts. This can take several different forms. One, the thoughts can be fragmented, so they are very random and they do not follow a coherent sequence. You may say to someone with schizophrenia, hi, how was your day? And the answer might be, I like cats. Have you ever seen a red truck? The weather outside is raining today. It's very fragmented and broken, and nothing flows. Also, under disorganized thoughts, the thoughts can be very bizarre. For example, you may ask a schizophrenic patient a question, and they may answer you by saying, that picture has a headache. Very bizarre and off-the-wall, unusual statements. Delusions fall under disorganized thoughts. These are false beliefs that one has. It's like a storyline going on in their brain. Many people with schizophrenia have delusions of persecution, that people are after them, like the CIA or the FBI or aliens are after them and want to steal secrets from their mind. So they often seem paranoid and afraid because they actually see these people coming after them. A lot of these delusions can be grandiose or grandeur, and that would mean that they believe that they are someone great, like the Queen of England or the President or Jesus. Hallucinations would be the second symptom, and here these are usually coupled with delusions. These are having some perception without any sensation. So seeing things, hearing things. A lot of people with schizophrenia will hear voices talking to them. They're usually very negative voices, maybe telling them to hurt themselves or someone else. But they can also experience sensations on the skin, smell, and taste, and so forth. The third positive symptom is inappropriate actions and emotions. Many people with schizophrenia will have these unusual actions such as pacing or rocking or twisting their hair constantly. The emotions may be inappropriate, so if you're telling a story to someone and it's a sad story, they may respond by laughing. So they have an inappropriate emotional response. So those are the positive symptoms. Negative symptoms, this is lacking of some appropriate behavior. So the first one is a flat affect and lacking emotion, basically. A lot of times someone with this symptom, their face just never changes, the muscles never change. So they may say, I am so happy, I am so sad, and you would never know by looking at them what emotion they were experiencing because they have that flat affect. The second negative symptom is catatonia, or being catatonic, and this is rare. It only affects about 1 to 2% of all people with schizophrenia, but it's like being frozen in some usually awkward position for an extended period of time, as if they are in a trance. 1 out of every 100 people will develop schizophrenia worldwide, so the rate of prevalency is 1%. So there are 4 different types of schizophrenia that we're going to look at. I'm going to talk about each of the 4 types, well, 5 types, and all of the symptoms associated with those. So the first type is paranoid schizophrenia, and this is the most common. It affects roughly 85% of all people with schizophrenia. With paranoid schizophrenia, one would have the hallucinations and delusions. And thankfully, this is the easiest to treat. There are antipsychotic drugs that control the hallucinations and delusions by decreasing the dopamine levels, such as Haldol and Thorazine. So although it is the most common, it is more successful and easy to treat. So it's called paranoid schizophrenia because, as I said, a lot of the delusions involve some persecution, so they're paranoid. The second is the second is undifferentiated, and that simply means that the person has a bunch of different symptoms from the other types, and you can't really pinpoint them being paranoid or disorganized or catatonia. So we would say they have undifferentiated. They have symptoms from all of the different categories, or at least 2 or more categories. The unorganized, that would be if somebody's having the inappropriate emotions and actions and the bizarre statements and the flight of ideas that are very loosely connected. They almost look confused or disorganized when you speak to them. Catatonia, again, catatonia is rare, and that is when someone would have these periods where they're frozen in an awkward position for an extended amount of time. The last category is residual, and this is when someone is being treated, and usually the hallucinations, the delusions are gone because they're taking medication, so it's in remission. They're never fully cured of schizophrenia because you would have to keep taking the medication in order to keep the delusions and hallucinations from coming back. So they're just in remission. Cause of schizophrenia is unsure at this point, but there are a lot of studies looking at trying to isolate a gene associated with schizophrenia. We do know in twin studies there is a high prevalence. If one twin has schizophrenia, that the other one would. There's a picture of the Ghanaian quadruplets in the 1940s. All of them had some form of schizophrenia. We do know that there's something physical going on. There's an excess of dopamine. Therefore, the antipsychotics help bring the dopamine levels down. They have an overactive thalamus, which is responsible for transmitting sensory messages. But there's also studies with mid-pregnancy viral infections. So they look back when the person was in the womb, the mother had some infection, usually associated with a high fever, that they believe must interfere with brain development at that time. Dissociative identity disorder was formerly known as multiple personality disorder, or split personality disorder. Dissociative identity disorder is characterized by the existence of 2 or more personalities within the same person. This is observed in 1 to 3% of the population. The individuals affected by this disorder struggle mainly with the transference from one identity to the next, or by overlaps between multiple identities. Each of the different personality controls the individual's behavior at different periods of time. When they are under the control of one particular identity, the individual may be unable to remember what happened while not in control of themselves. So they may feel like they've had this loss of time. So if the original that they were born as, they go into a different personality, and that personality goes out and buys furniture and clothes, and then you go back to the original personality, and they can't figure out where all of these things came from and account for that time loss. The alternate personalities have different mannerisms, body language, attitudes, thoughts, and can even be different gender orientation. Differences between the personalities are often remarkably recognizable. Someone with dissociative identity disorder may have as few as 2 or as many as 100 personalities. The time loss is often common, as I said, among people with DID, and when they first seek help, they are usually completely unaware of their condition. Often people with DID are suicidal or depressed. They are very confused, and approximately 1/3 will even claim to have some type of hallucinations. This disorder is almost always caused by abuse or some traumatic event. It helps someone, when they dissociate, tolerate or escape that harmful situation that seems impossible to survive. So while someone is being abused, they start to channel their thoughts or dissociate their thoughts away from what is occurring and start to imagine maybe they are someone else, somewhere else, and that then envelops into that new personality. This allows the individual to endure the hopeless and horrible situations and still maintain some sort of healthy functioning. So this usually shows up still in childhood.